If you've been told you might need anterior lumbar interbody fusion or ALIF surgery, you're in the right place. I believe that when patients truly understand why something is being done, they feel more confident, less anxious, and ultimately recover better. The challenge is that most explanations you find online regarding this surgery are overly technical, full of anatomical terms, but light on clarity. I'm Dr. Richard Hurley, a board-certified orthopedic surgeon who has completed a spine fellowship, and I've performed hundreds of these operations. My goal today is to explain ALIF in a way that's simple, accurate, and empowering. We'll talk about when it's used, what actually happens during surgery, the benefits and risks, and what to expect in recovery. We typically consider an ALIF when non-surgical care, things like physical therapy, medications, or injections, haven't provided lasting relief. This procedure can help with the following: degenerative disc disease, where a worn-out disc causes chronic pain; spondylolisthesis, when one vertebra slips forward, creating instability; pseudarthrosis, or non-union, when a prior fusion didn't fully heal; spinal imbalance or deformity, when alignment is off and needs correction. In short, ALIF is a powerful tool for patients whose spine needs both stability and realignment. It's about fixing the foundation, not just masking the symptoms. So if you've been told your spine needs a fusion, here's what that actually means. Unlike most spine surgeries that go through the back, anterior lumbar interbody fusion approaches the spine from the front, through the abdomen. This allows us to completely remove the damaged disc, to free up any pinched nerves, and place an implant, often referred to as a cage, that restores height and helps the bones fuse together. Because we come from the front, we don't cut through your back muscles. That means less muscle trauma and often a smoother recovery. Think of it like repairing the foundation of a house by lifting it from below and not cutting through the roof. Now, that unique approach is also what gives ALIF its biggest advantages. The main goals of ALIF are to relieve pain, to correct spinal alignment, and to create long-term stability. The benefits: direct disc removal and larger implant placement for a solid fusion is what we do. Better restoration of natural spinal curvature or lordosis, and there's less disruption to back muscles. There's proven pain relief and function improvements for most patients as well. There are risks to be aware of. Like any surgery, ALIF comes with risks. Some are unique to this front approach, and we're going to go through those. Vascular injury. The major blood vessels in the abdomen sit right in front of the spine, and while most are handled safely, there's a small chance of injury. Studies report rates between 1 to 5%, depending on the spinal level and the surgeon's experience. Retrograde ejaculation in men. In men, the small nerves that control ejaculation run near the front of the spine. These can sometimes be affected, leading to what's called retrograde ejaculation. It happens in about 2 to 5% of male patients. It may create problems from a fertility perspective, and you should think about choosing a different approach if this is a concern. Infection. The risk of serious infection after anterior lumbar interbody fusion is low, usually under 2% in most modern studies. Non-union. Sometimes the bones don't fully heal together after surgery. This is known as a non-union, or also as a pseudarthrosis. This occurs in about 5 to 15% of cases, and the risk is higher in smokers and when multiple levels are being fused. But as an aside, ALIF surgery is the most powerful spinal fusion technique to be performed in the lumbar spine, and is frequently the preferred fusion technique when other surgical treatments have been attempted and failed. Nerve injury. Although rare, nerves in the lower spine can be stretched or injured during this surgery. Permanent nerve damage is uncommon, reported in under 1 to 2% of patients. I typically use neuromonitoring to help identify and even prevent neurologic complications in these cases. Implant or hardware issues. The cage or the screws placed during surgery can occasionally shift or loosen, especially in patients with weaker bones, such as those with osteoporosis. These issues are uncommon but possible, and typically we try and treat osteoporosis before surgery. General surgical risks. As with any operation, there are general risks, such as anesthesia complications, blood clots, or injury to nearby abdominal organs. These complications are rare and can usually be managed safely when identified early. There are also other risks to consider, such as an abdominal hernia, which can require repair; ileus, which is a process in which the transit of food through the intestines slows down after surgery; seroma, or sterile fluid collection formation; and lymphatic leak that can also require drain placement. These risks are not frequent, but can require early identification and treatment if they happen. While these risks sound serious, it's important to remember that ALIF is a well-established and safe procedure when performed for the right reasons by an experienced surgical team. Knowing the risks helps you make an informed decision. So, what if you're not ready for surgery? Let's look at your other options. Not everyone with lower back pain needs a fusion. We use physical therapy to strengthen the core and improve movement, use medications or injections for temporary relief, posterior fusion, options like T-LIF or PLIF can also approach the back from a different angle, and artificial disc replacement for select patients who want to preserve motion. The key is tailoring the treatment to you, your condition, your goals, and your lifestyle. Surgery is just one tool in the toolbox. And if ALIF is right for you, here's what recovery looks like. Recovery varies depending on the approach and your overall health, but most patients are pleasantly surprised. Many patients go home within 1 to 2 days. Walking starts almost immediately. Light desk work can be done in just a few weeks, and heavier activity usually resumes in a few months. Fusion itself continues to strengthen for about 3 to 12 months. Recovery isn't about rushing to do things. It's about consistent progress and trusting the process. Healing the spine is a marathon and not a sprint. So to recap, ALIF, or Anterior Lumbar Interbody Fusion, is a safe and effective procedure to relieve pain, correct alignment, and stabilize the spine when non-surgical treatments haven't worked. The best surgery isn't just about fixing the spine. It's about restoring your quality of life. If this video helped you understand ALIF better, please like the video, subscribe for more spine education, and drop your questions in the comments below. I'm Dr. Richard Hurley. Thank you for watching, and take care of your spine.